nowadays they have shoes for everything. Running shoes, weightlifting shoes. They even have sandals that are meant for increasing the arch of the foot. But these are all, it's like a Band-Aid.
Yes, exactly.
Got to fix the root cause. We talk about that a lot here. It's one of Dr. David Singh's, the muscular imbalance.
Hey everyone, this is Raul.
Hi, I'm Coach Jay.
And this is
Joint Effort. What up, Coach? How you doing, man?
I'm doing excellent, Coach. I got one for you. This is a good one.
All right.
So we're looking at some questions from our community that we have in the knee and the hip arthritis programs that we have online.
Yes.
So just to give you guys a little bit of context, this question is coming from a person that is in our knee arthritis recovery program. And in essence, what she's asking is, she doesn't feel very comfortable when she walks, or when she wears shoes. She's having some issues with walking and choosing what shoes to wear. Her technique feels a little off when she walks. The reason why she has these concerns is because as a part of our program, we have people working on their feet, because alongside with the glutes, having stronger foot muscles and stronger ankle muscles can help you a lot with decreasing the pressures that go through your knee joints in several ways.
Right.
So in her question, Katie sounds it sounds like she's at loss because she feels like she's far behind where she should be. And so far she's doing excellent. Katie, I just want to give you a shout out. You're doing excellent in July's challenge. But Coach James, if you had to talk to her right now, what would you recommend to her? And what are some words of encouragement that you can give her? Because this is not a quick fix, absolutely not. But this is something that she already has the tools to fix.
I think that in general, even those that aren't here on our programs, I think that the feet are overlooked. When it comes, we expect our feet to be strong because we've been walking for years, right? And if you're dealing with some knee arthritis, in this case, you've probably a little bit older, so you've been walking for years. So you just assume I've got nice, strong feet. But when she was presented the knowledge, of hey, this is what's going on with your foot. If you can do this, if you can't do this, then you should work on this or that. I think she realized and she started paying attention to how things felt when she was walking, or like you said, just simply trying to find a comfortable pair of shoes. So just like anything else, the shoes are like a supplement, right?
Yes, exactly.
You wear them to, protect your feet from, stepping on rocks or anything like that. But nowadays they have shoes for everything. Running shoes, weightlifting shoes. They even have sandals that are meant for increasing the arch of the foot. But these are all very momentary things, right? It's like a Band-Aid.
Yes, exactly.
Got to fix the root cause. We talk about that a lot here. It's one of Dr. David Singh's, the muscular imbalance. So the feet can also be a victim of that, right? Of the imbalance. So for Katie, we took a look at how she's walking and different things like that. So we have an exercise. Toe curls. Simply curling the toes, trying to see the knuckle of the foot pop or show, and holding for 10 seconds. Again, that 10-second hold is very crucial, very important to build that mind-muscle connection. We want you to be able to do that without thinking about it. Just much like you breathe, your heart's beating. We want those toes to be able to do their job, right? To help balance the lower leg, the shin bone, and just put it into the proper position. So that way you can control the forces that are going through the knee joint. So we took a look at that, simply worked on toe curls, transverse arch activation as well. Another one where you're just pressing the toes into the floor and increasing the arch of the foot. Really just trying to get it strong. We want to see these muscles gain conditioning, endurance. So that way when you are doing activities like walking through the store, you can really utilize those muscles and get them to function properly.
Correct. People are surprised when their feet get just a little bit stronger.
Yeah.
How different their gait can become.
Yep.
One of the issues that I do see with people often is that their gait patterns or the way that they walk, it can change because there's not a lot of strength in the lower leg.
Yep.
Oftentimes, people, when they do physical activities that have more integrations, I want to think about something like a squat. Like you have more joints moving, and you'll see the ankles kind of roll in a bit when someone's doing a squat, and now their glutes, they just kind of shut off because they just cannot engage as well. But when someone gets stronger feet with doing exercises like a toe curl, like the exercise that you mentioned, where you create a transverse arch through pressing your toes against the ground, then you start seeing that there's more transfer, or like a better transfer from foot to knee to hip.
Correct.
Also, which is one thing that we do see, and it could be or could not be related, but I do see people that have foot issues since they're kids, like they had surgeries before, they had sprains, or they had foot arthritis.
Yeah.
Eventually they're dealing with knee arthritis, and then they're dealing with hip arthritis, and then it just kind of trickles up the chain.
Yes.
And we just talked in a recent episode about how you need to be obsessed with working on your glutes. I think about the feet the same. I think your foot muscles should be strong too. Mind you, there could be a little bit of confusion there because some people will look at the calf muscles, the big chunky muscles that you have right below the knee. You want these bad boys to be strong too, but there's other muscles that are right underneath, like not that close to the skin, that are important too, and that they help with controlling how your ankle moves. Also, you have the muscles that curl your toes. Like if you currently have hammer toes, or like an issue where your toes don't have a lot of mobility, then what I would invite you to do at home, if you're watching this, is take off your shoes and start curling your toes. See if you have some mobility. Bring them in. If you're cramping, you have a pretty bad weakness in the foot. So you need to start working on some very light contractions. You need to start getting your feet to become more active.
Right.
So that when you are doing any physically demanding activity, because walking could be demanding for some people. There's a it's a spectrum. For some people, it could be just a leisure activity. For some, could be a more strenuous activity. But if walking is strenuous for you, then you need to definitely get your feet muscles stronger.
I like that you bring that up. I myself personally have started trying to get the 8,000 to 10,000 steps on a daily basis, and it made me a believer in having strong feet to get through that. I know that is a goal for a lot of people, just to simply walk. We had Donna talk about walking in very nice landscape, nature, birds, and then the rain started falling. And for the first time in a long time, she was able to walk without pain in her knee joint. And that was all thanks to working on the muscular imbalance, which includes your feet, right? So think about that. I would love for everybody that's dealing with some knee pain or hip pain to enjoy those nice, beautiful walks with your loved one, your partner, your kids, your grandkids. I think that's great. But like you said, this, again, very simple exercises, but really increasing the strength of your feet is definitely going to help. And you mentioned something the cramping.
Yeah.
That is something that happens to a lot of, even myself still to this day. I work on hundreds of toe curls and arch activations a day, but I still get to that point where it's still a little uncomfortable. So these things should be done frequently. You have to have frequency. It's not so much about the intensity, trying to go 100% all the time, but rather start light, 10, 15%, and just gradually increase that over time. But with frequency, it will come endurance, and you'll be able to do more over time. And before you know it, you will be doing those nature walks.
Yeah, absolutely. I also think about shoes, like shoes that you wear for comfort. And, a question that comes up very often is, what type of shoe should I be wearing?
Yes.
Should I be wearing inserts? Should I go get fitted for an orthotic insert for my shoe? And I say, you know what, like, yes, absolutely. You can do all those things so that you can move more comfortably.
Right.
But long term, and this is just because this is what we know about muscles. look, I used to wear a size small in my t-shirts. I don't do it anymore because I hit the gym pretty hard. But your feet can do the same. They can change. Like so you're working on your foot muscles. There's gonna be some changes. I mean, maybe they're not huge changes that you can visually notice, but whatever orthotic that you have in your shoes might become outdated for your foot later in life. So if you're thinking of spending a lot of money on orthotics, I would say get some shoes that are comfortable first.
Yep.
Work on your foot muscles as much as you can, as much as time allows, as much as your body will tolerate. And then, after a few weeks or months, then maybe consider making an expense like that.
I like that.
But again, it's not a bad idea to make yourself comfortable. After all, one of the things that we always advise people to do, especially when they have an active problem where they're swollen, where they have a lot of pain, they're irritated, we ask them to use an offloading device. We ask them to use a cane, to use a walker, a cane, and temporary things just so that you can get yourself out of that irritated phase. So you can do the same stuff for your foot. Just remember that the root of the problem is that there's muscular weakness that you need to fix.
Right. So it all ties back into the imbalance. Everything is connected. I think you mentioned it earlier, Coach. Those that have a problem with their toes or any kind of situation usually have knee pain. Yeah. Knee pain leads to the hip pain. Compensation patterns, right? How you're adjusting the load to make yourself more comfortable, just to get through your day-to-day activities. And these are usually people that are just simply trying to walk in the grocery store, or again tackling things inside of their home. Stairs are the boogeyman. I think a lot of people are worried about stairs and their knee health, and a quick fix, not a quick fix, but a good gateway, a good starting point would be working on your foot muscles.
Yeah, I like that you're talking about stairs, because this is a topic that we could expand on. Man, this could be like this episode might as well be called like talking about stairs. Yeah. But stairs is a huge one. When you have a person that has very weak foot muscles, right, or have arches that collapse,
that part,
you'll notice that the knees can kind of cave in inwards. We call that knee valgus as you're coming up or coming downstairs. And over reliance on the quad muscles can happen because you just don't have access to your glutes at that point. If you cannot rotate your leg outwards as you're taking a step up or you're taking a step down, you're gonna have a harder time feeling these muscles work. That's right. So if you're someone who struggles with the stairs, I would say, yes, get your glutes very strong. That's something that I think is very important to do. But start taking a look at your foot. Like make sure that you're taking care of your feet, that you're strengthening these muscles, that you're curling your toes. If you're more advanced, if you're more progressed, like maybe lift your heels off the floor a little bit. Get that posterior tibialis muscle a little bit stronger. But it's gonna take a while. Like foot muscles, I think it's one of those areas that there's not an instant change.
And I think that ties back into us using our feet so frequently. Yeah, it does take more effort, more time to correct certain things. And think about it. You've probably dealt with this situation for years, and you just put it off. You're like, I'll soak my feet in this Epsom salt. Yeah. And, I'll get the new $150 shoe that's supposed to end knee pain. Yeah. But again, just start working on the muscles. Think about the muscles. Think about how your body's moving, how you're moving, how you lean or sway when you walk. And think about how just strengthening your feet can really make all the difference there.
Yeah, absolutely. So to tie back to the question that we were talking about right now, don't be discouraged if you're someone who's dealing with foot issues. It will take some time, and you might not be able to see a change within a week, but if you're consistent, you can absolutely change how your feet look, move, and how strong they are.
That's right.
So anyways, that's all for us today. Coach Shane, pleasure talking
Coach.
to you.
And we'll see you guys next time.
In the next episode of
Joint effort.